Assalamualaikum warahmatullahi wabarakatuh. Now our group will present survey on hypertension. What is high blood pressure? Blood pressure is the measurement of the pressure or force of blood pushing against blood vessel walls. When you have hypertension, it means the pressure against the blood vessel walls in your body is consistently too high. Your blood pressure changes throughout the day based on your activity. The higher your blood pressure levels, the more risk you have other health problems such as heart attack, heart disease, and stroke. What are the types of high blood pressure? There are two categories. The first one is primary. Causes of this most common type of high blood pressure include aging and unhealthy habits like not getting enough exercise. The second one is secondary. Causes of this type of high blood pressure include different medical problems, for example, kidney or hormonal problems, or sometimes a medication you are taking. What causes high blood pressure? Food, medicine, lifestyle, age, and genetics can cause high blood pressure. Your doctor can help you find out what might be causing yours. Common factors that can lead to high blood pressure include: the first one is a diet high in salt, fat, or cholesterol. Chronic conditions such as kidney and hormone problems, diabetes, and high cholesterol. Family history, especially if your parents or other close relatives have high blood pressure. Lack of physical activity. Older age. And lastly, stress. How is high blood pressure diagnosed? High blood pressure is diagnosed with a blood pressure monitor. This is a common test for all doctor visits. A nurse will place a band cuff around your arm. The band is attached to a small pump and a meter. He or she will squeeze the pump. It will feel tight around your arm. Then he or she will stop and watch the meter. This provides the nurse with two numbers that make up your blood pressure. The top number is your systolic reading, the peak blood pressure when your heart is squeezing blood out. The bottom number is your diastolic reading, the pressure when your heart is filling with blood. You may also hear the doctor or nurse say a blood pressure is 120/80. Normal blood pressure is less than 120 on top and less than 80 on the bottom. Pre-hypertension levels are 120 until 139 on top and 80 to 89 on the bottom. While for high blood pressure, stage 1 is 140 until 159 on top and 90 to 99 on the bottom. And lastly, high blood pressure stage 2 is 160 or higher on top and 100 and over on the bottom. High blood pressure treatment. Your doctor may recommend that you make lifestyle changes including eating a healthy diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight if you are overweight or obese. But sometimes lifestyle changes aren't enough. If diet and exercise don't help, your doctor may recommend medication to lower your blood pressure.
Now we move to the problem statement of this study. Hypertension is a major public health epidemic around the world, and it is associated with an increased risk of numerous chronic conditions such as stroke, kidney disease, and coronary heart. It is estimated that 1.13 billion people in the world are suffering from hypertension. Therefore, the problem statement of this case study is how does hypertension occur among society, and the best treatment for hypertension we will identify based on the questionnaire that has been created in this study. The objective of this study is, first, to increase public awareness of hypertension as a significant public health problem. Second, to investigate the main causes and symptoms experienced by people with hypertension. Third, to determine the most effective prevention of hypertension. And the last is to identify the best treatment for hypertension patients.
Assalamualaikum warahmatullahi wabarakatuh. My name is Amirin Zufaidi bin Abu Rahman, and for today I am going to talk about materials and method. We chose Google Form as our platform to conduct this survey because it is quite difficult for us to conduct face-to-face survey during this pandemic breakout. Another reason is because Google Form is easy and simple for everyone to understand and use it. As for the method, the Google Form link was spread on WhatsApp. The given Google Form link will be opened for about 1 week. After accepting all respondents' response, the data was observed and recorded. Later, in the next slide, there are some of the questions that we use when conducting the survey.
Assalamualaikum, my name is Siti Akila Najwa and I will continue this video to talk about result from our hypertension survey. From 50 respondents, there are 13.6% or 9 respondents are from age 25 and above, while 86.4% or 57 respondents are from age 13 to 24. While for gender, there are 30.3% of them are male and 69.7% are female. For hypertension experience, there are 19.7% suffer from teenagers, 7.6% from adults, and 72.7% our respondents are not suffering hypertension. 56.1% from them has family history in hypertension, while 43.9% has no family history in hypertension. Our respondents state that 13 of them has symptoms like cool hand, difficult in breathing, and fatigue, while 50 of them are having chest pain. 20 of them has nosebleed. For vision problems, they are 19 and several HH are 25. 22 of them had sweating. Blood in urine and eyes are 1 and 2. Most of them, or 49, also state that stress can be a cause of hypertension. 28 of our respondents are agreed that too much salt in diet are causes people suffer hypertension. 29 of them also choose lack of physical activity can lead to this disease. For obsessed and genetic, 20 and 23 of them agree, while 10 and 6 respondents agree that smoking and too much alcohol consumption can lead to this disease. 54.8% are having unhealthy diet, while 50.2% are consuming healthy diet. 25.8% will check their blood pressure for every 3 months. Weekly are 1.5%. Monthly are 18.2%, and 54.5% did not check it. For hypertension diagnosed, 43.9% are not having it, while 36.4% from lab tests, 13.6% from ambulatory monitoring, and 3% from electrocardiogram. 47% of our respondents are agree that 120 to 129 mmHg or 18 to 89 mmHg are the normal reading of blood pressure. For prevention of hypertension, 59 are agree eat healthy diet can help. 57 are agree get enough sleep, while for physical activities are 47. Foods that can prevent hypertension. They state that oats are the most food can prevent hypertension. 61 are agree, and 51 of them are agree that banana can help prevent hypertension. For fast and fried foods, they are one of. This is our conversation with our respondents.
For these questions, respondents can choose multiple answers on what are the best treatment for hypertension. According to the data, 53 respondents chose eating a heart-healthy diet with less salt, followed by getting regular physical activity with 50 respondents, and reduce stress and tension by 47 respondents. The lowest answer chosen by the respondent is limiting amount of alcohol that you drink with 17 people. On this question, respondents also can choose multiple answers on what are the hypertension medicine that they know. But majority of our respondents don't know the hypertension medicine with 41 people. In addition, there are 12 people chose calcium channel blockers and diuretics. According to the data obtained, 19.7% of our respondents started experiencing hypertension during teenager and 7.5% during adulthood, while the rest do not experience it. But 56.1% of our respondents have family members who also suffered from hypertension. According to the CDC, a family history of high blood pressure is a risk factor for you developing high blood pressure. Having one or more close family members of high blood pressure before the age of 60 means you have twice the risk of having it as well. It is important to understand that a family history of high blood pressure does not mean you will have high blood pressure, but it does increase your chances. Majority of our respondents have severe headache symptoms followed with sweating, vision problems, and chest pain. Also, most of our respondents, which are 54.5%, do not check their blood pressure regularly. According to WHO, hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning sign or symptoms. For this reason, it is essential that blood pressure is measured regularly. When symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. The only way to detect hypertension is to have a health professional measure blood pressure so you can know whether you have high blood pressure or not. We also asked respondents if they knew what a normal blood pressure reading was. Surprisingly, 57.5% chose the wrong answer. It's very important to know the normal reading of blood pressure because even if you have healthy blood pressure numbers, it's important to take preventive measures to keep your blood pressure within a normal range. This can help lower your risk of developing hypertension, heart disease, and other complications of high blood pressure. On the question of how to prevent hypertension, the majority of respondents are aware of hypertension prevention. However, a small percentage of our respondents chose the incorrect prevention, including foods that can prevent hypertension. In addition, the majority of our respondents also often eat fast food. Fast food is notorious for being unhealthy, largely due to the high amount of fat, salt, and calories contained in the processed food. Over time, consumption of this food can contribute to weight gain, high blood pressure, and high cholesterol. These factors are known to increase risk for heart disease, which is the leading cause of death worldwide.
As a conclusion, high blood pressure, also known as hypertension. Hypertension is a condition when a person having higher blood pressure than usual. If you get any symptoms, immediately do precaution steps so that you can protect yourself from any further disease such as heart disease or stroke.